Good. Well, you don't know. It's how you're supposed to get on. Yeah. Mark, how you get to see you.
Dr. Hiratsuka. The Ethical Tribal Engagement Series, our Sacred Science, a conversation about traditional healing research of tribal nations. I mean, two close together. Native well-being and tribal sovereignty. And we're honored to have our distinguished group of panelists here with us to explore this topic together. I'm so sorry, y'all. My name is Tana Fitzpatrick, and I'm in the role of Associate Vice President of Tribal Relations, as well as the Director of the Native Nations Center for Tribal Policy Research. Together, we are the Office of Tribal Relations here at the University of Oklahoma, and we are in the Office of the President. We welcome our in-person attendees as well as our virtual audience. Thank you for joining us. I cannot tell you how thrilled we are to have you today. Today has been a labor of love, and we're just so happy that you all have taken time out to be here with us today. The Ethical Tribal Engagement Series is a university initiative hosted by the Office of Tribal Relations and OU's Center for Faculty Excellence. The purpose of the series is to support respectful and ethical relationships with tribal nations. In addition to today's event, we are excited to announce that our Ethical Tribal Engagement Canvas course is now open. We have a basic course that's open, and it's designed to help OU's employees deepen their understanding of tribal sovereignty and improve tribal engagement across all university units. So please check it out. And if you're an OU employee, you should be able to search and find the site and use it as a refresher, go back, and it's there to be a resource for you. Quick housekeeping. We apologize, the food was meant to be here 30 so minutes or so you can see their setting up out here. We want this to be comfortable. We want you to be fed. We want you to be able to move about. So please, when it's ready, please feel free to go get some food. Hopefully there's some takeaway stuff too for you to take with you. And also the restrooms are down the hall this way. And if you need your parking validated, you can drop it off at the desk and we'll get that taken care of for you. We want you to feel at ease so you can fully engage in this important topic. And again, thank you all so much for being here. Now I would like to turn it over to Chris Tallbear to open us up with a blessing.
Got all kinds of microphones. You guys hear me okay? I want to say thank you guys for taking time out of your day to come and be a part of this conversation. I'm going to pray and ask that you guys pray along in your own way. Then oh Creator, we thank you for giving us this day, giving us this opportunity. I pray that you be with everybody here, that everybody that's made a way here to be in person, and those that are attending virtually. We pray that they get something good take away from this, and that they can take it back to their communities. We pray that you be with the university, tribal communities. We pray that you be with our elected leaders, elected tribal leaders. You know, many tribes are getting ready to go into ceremonies, Creator, the renewals. I pray that you know, bless all of them and the prayers that they're seeking. I pray that everybody makes it through in a good way, you know, and comes out stronger on the other side. Creator, you know, I know that there's a lot of unrest and things going on in this country that, you know, has caused a lot of division. And I pray that, you know, some of these words, this knowledge, this information that we're sharing will help lead to some good solutions down the road that, you know, we can come together. You know, we pray that you be with the staff here that help put this together. It's, you know, a very, very sacred topic, and you know, we pray that you guide all of us up here, our words and our hearts and our minds, that we can work together as one to help, you know, educate and convey a good message. You know, I pray that you be with all of us as we get ready to travel home. Pray that you bless our homes and find them, you know, better than we left them. If we've overlooked anything, we pray that you give us aho. Thank you.
Amen. Thank you. Thank you so much, Chris. And now I'd like to welcome Senior Vice President and Provost, Dr. Gary Raskob, for University Welcome.
Yes. Thank you, Tana. And it's really my privilege to welcome all of you to this program, Sacred Science, Conversation about Traditional Healing and Research with Tribal Nations. Thank you to all our tribal leaders. I'd like to thank Secretary Terry, particularly for coming down for this program today. Thank you to all our panelists for your commitment, preparation, and time. I'm sure it's going to be a very good conversation. Thank you, Tana, for your leadership in organizing this. Thank you to all staff and others who had a role in helping you know, make this day and this discussion possible. Today's program really brings together tribal, public health, and research perspectives to engage in a conversation that highlights the importance of listening to a range of tribal and institutional voices in order to deepen our understanding of respectful, reciprocal engagement with our tribal nations and their citizens. With over 20 tribes and tribal organizations from across the country, including those from Alaska represented here, and with over 45 OU departments and institutes represented today here across all of our campuses, this gathering reflects a national commitment to collaboration. As a Health Sciences Institute, we are called to reflect, adapt, and approach these conversations with humility and integrity, reminding us that ethical engagement is as much about how we work with each other as it is about who we work with and on what. Today's engagement represents a key step in the University of Oklahoma's renewed commitment, clearly articulated in our strategic plan, to set the highest bar for meaningful partnership between a public university and tribal nations. And so in closing, I would say on behalf of the University of Oklahoma, thank you for being here. Thank you for all that you do. Thank you for engaging in this discussion. We're truly honored to host today's event. We know there is much we can learn from you and look forward to our discussion together. Thank you and welcome.
Thank you so much, Provost Raskob. With over 45 university units and over 20 tribal organizations from across the country in attendance today, I think it really speaks to the interest and the need on this important type of conversation. And so thank you again, Provost Raskob, and also thank you to Vice Provost Jill Raines and also Jen Montour for their, so much help went into today's event. We greatly appreciate the Office of the Senior Vice Provost, President and Provost. Okay, so we're gonna go ahead and get started. I'm gonna go and sit down. I feel like I won't be able to see you all as well, but I'm right here. So I'm gonna ask the panelists a series of questions. We're gonna start off with two general questions for each of the panelists, and then we'll have specific questions for each of the panelists. We're going to hold questions and answers until the end if we have time, and we hope that we will. And so for the meantime, it's going to be a conversation style up here with the panelists. So let's go ahead and get started. I'm going to do a brief introduction of each of the panelists. So right here to my right is Chief of Staff Jeff Fife from the Muscogee Creek Nation. And he is the Chief of Staff to the Principal Chief Hill, who was supposed to be here and got called away at the last second. So thank you so much for being here, Mr. Fife. He is a second-generation tribal leader with over 20 years of collective experience in the fields of tribal law enforcement, tribal administration, commerce, interior affairs, and in the Muscogee Nation legislature. He will speak to issues around tribal governance and health. Thank you so much. Next, we have next to him, Chris Tallbear, who is a Southern Cheyenne tribal traditional healer and hails from the Cheyenne Arapaho tribes. And he serves as the tribal public health advisor for the National Network of Public Health Initiatives. He has lots of great experience, including serving his tribe as well as serving the city of Norman. He will speak to the importance of developing a shared understanding and respect for traditional healing methodology and practices. Next to him is Dr. Vanessa Hiratsuka. She's senior researcher and co-director for the National Resource Center for Alaska Native Elders, Southcentral Foundation Research Department. She has university faculty experience as well, where her research interests include ethical, social, and legal implications of genomic research and precision medicine among Indigenous populations, as well as other important areas of Indigenous health research. She'll provide insight into vital elements of community engagement and research. And last but certainly not least, we have Dr. Mark Doescher, who is the Inasmuch Foundation Endowed Chair in Cancer Screening, Outreach, and Education, and Professor of Family and Preventive Medicine in the College of Medicine here at the University of Oklahoma's Health Sciences Center. He serves in a variety of community engagement roles here as well. And Dr. Doescher's long-standing commitment to improving health equity in rural and tribal communities has led to studies funded by federal, state, private, and private entities. He'll speak to you all about bidirectional collaborative research efforts and respect for tribal sovereignty. So we're going to go ahead and dive in. And like I mentioned, we'll start with 2 general questions. And I would like also the panelists to feel free to build on each other's responses or offer complementary insights, or truly want this to be conversational style. So our first question is, when you think about research and healing, whether grounded in traditional knowledge, public health, or clinical science, what values do you believe should guide collaborative efforts between the university and tribes as sovereign governments?
I'll
Chris,
begin.
Chris, 5 minutes.
Yeah. Can you guys hear me okay? Okay. I think I might turn this on. I think I've got this. Yeah. Okay. You know, a while back I heard a native medical provider, talking. He was from Alaska, and his name was Dr. Gary Ferguson. And he said, we were talking about traditional medicine and research, and he said, nothing about us without us. So involving tribal nations to be a part of that research, it's part of CBPR, and it should be a tentative research in Indian country. But just like the work that I'm doing right now at a national level, involving tribal voices in those discussions, in the direction and the guidance, and being accountable to them. I think that's one of the things that should guide that. And whenever you go back and present, include your research in presenting your findings, raw, refined, or otherwise, tribal nations should be first when you disseminate. Talk to them and let them know how that went. So before it goes anywhere else, always with that.
Thank you, Chris. Let me see. Does this? Okay, there we go. I'm live now. Okay. Thank you so much, Chris. I love that. Nothing without us, about us without us. Dr. Doescher or Dr. Hiratsuka, is there anything there that jumps out at you? Yeah, go ahead.
We were fortunate in getting the questions ahead of time. So, one of the things that I've been thinking about, and I've been thinking about this inquiry a lot, first off, so what do you think about? And I think so frequently it's not what I think about, it's what I've been asking our community members about. And I have the opportunity as a Indigenous person who is a researcher to amplify the voices of our community members. And that's what I really often call it. I do both qualitative and quantitative research, and I feel that so frequently I get the joy and the blessing of amplifying what it is that our community members are saying. And I've had the blessing of asking them this question because we've been at the organization I work for that is tribally owned and managed. Our tribal leaders are very curious to hear from our community members, what is it that is health? What is wellness? How should health research be conducted? What does it mean to do this work? Is there a role for research in the conduct of healthcare and primary care and specialty care types? How do we manage these biological specimens that are used for cancer research? All of these things, and so what I've heard from our community members in Alaska and Southcentral Alaska, and also statewide across the 200 plus tribal groups that we have, is very much in alignment with what Mr. Paulbear was saying, insofar as this is what is the benefit? What is the community level benefit of this work? What does it mean to me? What does this mean to our next generations? How is it that we can carry on our ways of being, our values, our ways of thinking and knowing and doing? How do we have those things that are also in alignment? Can they be in alignment? And if not, what do we do? What do we not do? What should be known to others? What is information that should be staying with us? Those are the different things that I think are under consideration. And one of the great blessings, I think, in the work that I get to do as a health researcher is speak about voluntariness. And anytime a person is considering participating in a research project, anytime a community is considering participating in a research project, they can stop at any time. This information belongs to them. You can say what you want to say, don't say what you don't want to say. This aspect of respect, of control, of reciprocity, of benefit. These are all things that need to be borne in mind, and how we conduct ourselves as researchers that are also community members, that are also in maybe spaces of governance, are all within those beliefs that one holds, and how you've been taught and what you're continuing to learn.
Just real quick, Dr. Hiratsuka, why is it important to ask those questions? This stays with you. You can stop at any time. Has it always been the case?
So frequently there are power differences, between people, between communities, between governments, and it hasn't always been the case, and it often doesn't feel the case now. That we can say no, that an individual can say no, that we can stop doing something once it started, that you can pull back once you see something isn't going the way that you imagined it might once you were told something. And I think this is an area that, it's really important to continue saying what might be common sense in the way of the humans should interact with one another, that government should interact with one another. It's not common. And so it's important, I think, to consistently state that indeed this is voluntary, that these are, that when we're talking individual research as an individual participant, this is voluntary. Also between governments, this is voluntary. This is something that is under constant negotiation. We may start something, but we have, as tribal nations, the right to call it quits. We have the right to question what the processes are now that they're in place. These are all things that I think, again, are important to state, to restate, and to check in on.
Excellent, thank you.
Yeah, I just would like to add a little bit to that, because there is a power imbalance hats off in terms of this. And you know, speaking now more to the university audience that may not be grounded in tribal sovereignty and what that means in terms of research and research protections. People who do research have to go after grants and have to, you know, continue to get funding. So they're driven by a different set of parameters than what a community or tribal nation might value in terms of being what's important for that community or that value. So I think one of the things that always has to be considered is that there has to be structures for dialogue up front to get the information from the community. I think the principles you brought up about there being individual choice and tribal nation choice in terms of that research and research oversight. And I would say dissemination of findings, sharing of data, everything that goes with research. There has to be, when you're working with tribal communities, there has to be that interface and dialogue and a way to keep that going throughout the process. And it can be challenging for university folks because they're under timelines and funding pressures, and they want to move things rapidly. And really, this is often a long-term dialogue. So it is challenging, but I think holding those principles is essential.
Thank you. Chief of Staff Fife, any thoughts on what values do you believe should guide collaborative efforts between university and your tribe or tribal nations in general?
Yes, thank you. I was actually enjoying the conversation, learning quite a bit myself sitting here in just this short time. The principles that should guide us were outlined in brevity this morning at our introduction. The university has adopted policy to engage with tribal nations. And I think that's a very important first step. As our in-person audience, I'm aware we may have an online audience as well, but our in-person audience, the tables you sit at, they're all square. And I know if I move beyond this moment without injecting Principal Chief Hill's vision, he will ask, undoubtedly, somebody in this audience, how did the Chief of Staff address issues? So Chief Hill uses an analogy. Mind you, we negotiate with federal government, state government, our university partners, our local municipalities, other state entities. We were in a discussion with the governor in a conference room with a very long table. And Chief Hill mentioned this table is square, Governor. You're naturally sitting at the head of it, as it's your house, if you will. But the approach shouldn't be a long square table or a short square table. It should be a round table where there's no head of the table. There's nobody more important than the next. That's Chief's message. And I think in this environment, in this era, we have come a long ways in terms of relationship building. And it starts with tempered patience most often, but the willingness to sit down and discuss issues that are important to all of the communities we share. So hearing the panel's feedback this morning on this very first question is exciting to me. It gives us hope to know that I can only speak for the Muscogee Nation this morning, but there are 39 tribes in this state. We're all unique. We're all culturally unique. Our languages are unique. Our healing ways are unique. I say that all 39 tribes, though, are praying people. Maybe not in a Western sense, but maybe in a Western sense as well. We're seeking balance in a challenging environment that we understand two things very well. Muscogee Nation's history has been embroiled with war and battle and moments of friendship with the United States government until we landed here in Oklahoma as our final residence, if you will. Our nation isn't going to leave. We're not a company, we're not a corporation, we are a government. And to the faculty audience that may not be aware of these things, beyond our moment today, beyond the next president of the university, beyond the next chief or two chiefs or however many chiefs, we're still going to be here. And we're seeking partnerships. But the most important aspect that I can highlight is the respect must be given both ways. Certainly, clinical research is very important, but it's not more important than traditional methods and practices that have allowed my people to remain here for millennia. We understand this environment that we live in. We've adapted. We know some things that should only remain with our people. And the universities or pharmaceuticals or federal or United state government, they should respect that as well. We're not trying to be selfish with anything, but we're protective based on our history. So I would leave it with that.
Thank you. I appreciate those thoughts. I heard very much elements of personal sovereignty, individual sovereignty, tribal sovereignty. 39 governments here in Oklahoma, all of them distinct, unique. I really like that point that university research or other types of institutional research are not more important than traditional methods from the viewpoints that are up here and the people that you represent up here today. In that line, the second question is, how does traditional healing come up in your roles, if at all, if you feel like sharing?
Again, as a tribal public health advisor for a non-tribal serving organization, it doesn't. As a traditional person, yes. I think my first experience getting invited into an environment where there were researchers and other traditional healers was probably in 2013 or 2014. I got invited to participate with the Pan American Health Organization, which is part of the World Health Organization, but they brought together healers from South America and also from North America. And funny, I was the only one from North America, which surprised the heck out of me. But it was the interface with, traditional healers from around the Amazon. And, a lot of them, with the African slave trade, there's a lot of, mix and some of that knowledge, the tribalism from Africa, and how that interacted with indigenous people in South America and around the Amazon. But just having that dialogue, and I had a tough time learning Portuguese in about 20 minutes. But we had interpreters, and they'd have those mouthpieces or earpieces, and they'd ask questions, and sometimes I would answer in English, sometimes I would answer in Cheyenne, and it was interesting. Those interpreters had no clue what I was saying, so just no say, But that was, one of my first experiences in 2019. I want to give credit to Joseph Grovant, and he invited me to participate in a traditional medicine summit called Maintaining and Protecting Culture Through Healing. And part of that dialogue, it was the intersection of research, of health services, and traditional healing practices. And, just bringing together healthcare providers, academic researchers. There was a document that came out online from that 2019 gathering, and it can be found online at the Tribal Health Research Office, the outcomes for that. Some of that was to talk about how do you introduce younger people, younger tribal members into traditional medicine, into traditional healing, or getting them involved in the academic research aspect of it, but as a traditional person, being connected with our people, with my people, it comes up, it could be a daily thing, it could be a weekly thing, but a lot of times it's just people looking for advice, on protocol and procedure on how to go about things, whether that's traditional or ceremonial aspects, but providing sound advice to people. The other thing is sometimes people, through our daily interactions, we might pick up something negative energy, and maybe they want to be brushed off, which is kind of taking that negative energy and get rid of it for them. And, just kind of helping out in that day. Something could be simple like that. And also just, I think traditional people, part of our role is being a facilitator for ceremony, and that means different things to different people, whether it's an individual, a family, or a tribe, how that approach to healing and ceremony comes together. I will stop right there.
Thank you. Thank you. Go ahead,
If I could
Dr.
make
Doescher.
one comment, and it's not so much from a research perspective. From a research perspective, I don't know in Oklahoma how much we've looked into the importance of that vis-a-vis specific elements of what we do for research, and it's probably an area to be thinking about. But I want to put my clinician hat on for a moment. I'm still clinically active. I still round in the hospital. Before coming here, I worked for 16 years in the county hospital for Seattle-King County and Washington Harborview Medical Center. And they have persons from all over the world, groups from all over the world, and 80% of my patients do not speak English there. People from Cambodia, Vietnam, people from Eastern African countries and cultures within those countries. Within the hospital sphere, if a person was in the hospital, they had programs from members of the community who could come in and help with cultural mediation around what was going on with Western medicine for people who may not be familiar with it, or some who were but wanted the support. Here we have 39 tribal nations in the state. We have patients from far beyond that, probably hundreds of tribes represented. It's not a formal part of the process in this institution. I don't know if it could be or should be, but I think it is worth considering. There may be patients who would benefit from more emphasis in connectivity to traditional healing approaches rather than informal ones. A more formal mechanism toward that may well be worth considering. So that's just my comment on that.
Thank you. Dr. Doescher. Yeah.
I wouldn't call it traditional healing necessarily, but traditional practices are the ways that this applies, I think, in my work and the role that I have, but also the person that I am every day. Don't really switch between, oh, today I'm, gonna be Dr. Dr. Vanessa, and then just mom, or, other things. But instead, it's the way I think I try to hold myself. What I bear in mind from the teachings that I've been given, both in NIC and Wintu, and with that, how does that be put into practice as a health researcher, as a person that is a principal investigator of studies, working with different tribal nations, working with students. With that in mind, there are different ways that I might think through something and seek to enact these different methodologies. So I might utilize what would look like a Western methodology from an external point of view, but how I'm doing it, the intention that I have, the analysis, the interpretation, the dissemination, is coming from a different worldview, not necessarily a Western worldview. It's in companion alongside. I'm a bi-tribal person, so I think this is a way that I've been raised. Is here are different ways of looking at the world, of holding yourself. This is how different things ought to be, you know. And sometimes it's in conflict between those different backgrounds, and I have different voices in my head of how one ought to carry themselves in this different situation. To me, that's, for a while as a young person, it was confusing, and as I've gotten older, it's been more of a blessing to be able to have this internal dialogue, to think through how would you consider addressing a particular issue. And so it's not necessarily in ceremony as a formal practice, but as an everyday practice, if that makes any sense to folks. And with that, it's being prayerful, being hopeful. A lot of times I think, you know, maybe I'm a foolish optimist in that way, but no, it's being prayerful to put forward good hopes that something, these activities that we're doing, be it, you know, intervention in the community, the way that this training might be going, this dialogue might be going, this event that we're in right now might be, that there'll be information that is useful, that one can hold in their mind and heart and carry that forward, such that there can be peace and prosperity. You know, those are different ways that I've been taught to manage myself, and to think in the way of what is it to be in harmony.
Dr. Hiratsuka, I wanted to ask you something that's coming up for me while you're sharing. Can you describe for the audience moments when you can feel your mind shift, where, because in some respects I feel like you probably wear multiple, maybe multiple hats, but multiple worldviews, where you might be in a space where you put yourselves in the shoes of someone who doesn't hold that same, maybe it's a Western viewpoint. And do you feel that shift? And where you kind of balance both to help translate in a way that's maybe not, it's not Portuguese, and you know what Chris is mentioning, but the different kind of internal translation. Can you feel where I'm going with that question? And can you describe maybe a moment or just generally?
Some of the work that I'm blessed to do with a couple members of our audience, I see Bobby Sankey from the Chickasaw Nation. I see Paul Spicer from University of Oklahoma Norman campus. They're a couple of my longtime colleagues and good friends, and the work that we've done together has often been around genomics, genetics, precision medicine, data sovereignty, and what is the very essence of life, right? And how ought researchers to consider what questions are being asked in the way of genomic science, in the way of genetics. How do we manage these studies where there's quite a bit of promise to the community, but not necessarily an understanding by our laboratorians and others, and the way of what does it mean to be human, and what are the possible problems of in consideration and taboos that might exist if we were to you know, codify, to write down, to treat as a consumer our very beings, our DNA. What does that look like? How ought that to be done? And I often in those conversations definitely feel a shift. You know, one of my first jobs, my first paying job, was working on the Human Genome Project as a little scientist there, you know, doing my micropipetting and whatnot. And those questions that I had even then, you know, as a kid, this was before I even went to undergrad, I was in that laboratory, was, is this okay? How I'm managing, how I'm handling this biospecimen, how I'm handling this particular chromosome that it's human. is this okay? Ought these samples that, yes, we're replicating this portion of a chromosome so we can determine what's here or there, but how ought I to hold this? How do I talk to my laboratory manager about it? Is this the right way that just toss it into an autoclave and let it burn up? This feels odd. I've taken those same questions into the community. I know I'm not alone in this. How might this then be, how might we consider these things? Or how do we destroy a sample? How does this happen when, maybe a person feels that everything of them ought to go with them to the next, so they can carry on in their spirit may move on, maybe in a right way. And so, what does that look like procedurally in a hospital, in a laboratory? What does it look like? And these are the times, these are the areas where I feel like that additional portion of me, yes, I have the science background. Yes, I have, public health background, a policy background, but I also have this other part of me that's going, oh dear, this does not seem like this is how it ought to be. What ought to be though, and it's not, I feel it's not up to me to decide what ought to be. I can be a conduit in that, but this is a larger question of the people of which this information comes, of the individuals, of the community, of that nation, of multiple nations, and it's being in dialogue on that. It doesn't mean this is a cease and desist, but rather we haven't taken the time to discuss how might we do this, and what does that need to look like? And oftentimes it is a ceremony, but what type of ceremony? Whose ceremony? Breaking that down and having the wherewithal to stand in that discomfort, and continue that dialogue. I feel that these are very important multi-generational conversations to have. We're not going to come up with answers that are going to be good forever, but these are continual conversations, and it's very important, and I think all of us, as we're going through our different forms of training and our work and carrying on in our lives, these are things that, we have those opportunities to, and the responsibility, the individual responsibilities to call that question when it's on your heart and you feel it stuck in your throat.
Yes, yes. And when you mentioned discomfort, I often feel uncomfortable. Just in this work that I do, I have to see multi-directional, multi-tribal, multi-university units across all 3 campuses, and it challenges you. And I think a challenge for the audience and for those online is, how can you also feel uncomfortable? And maybe you're here today to learn. So in a way, you're being invited into a discomfort to grow and to learn a different way of moving forward, or at least seeing another perspective that perhaps would never come across your plate or your line of work had you not otherwise been open to learning more. I'd like to turn it over to Chief of Staff Fife for any viewpoints you might have that you'd like to share on how does traditional healing come up in your roles, if at all.
Thank you, Tana. Before I address that, I really appreciate the doorway that was just opened, the appropriateness of science and who's to determine that. Ujiabova Tazagea Testament Kajupne. Ujiabova Manlegidos. In my language, I just told everyone the tribal town that I'm born to. We're a matrilineal society. Almost every history book is written not by my people. And there was an archaeological dig. Since we're talking about universities and relationship with tribal governments, I'm going to speak on this. There was an archaeological dig in Wetumpka, Alabama, that deals with Ogiabola. The old Hickory Grant, which was the last meeting place of the Muscogee Nation government prior to removal. I'm not trying to make anyone uncomfortable, but I'm trying to express the importance of science and tradition, traditional customs of our people. Today, the university still holds at least 57 remains of our ancestors in plastic boxes, not controlled correctly by climate or other means. And it disrupts what was mentioned. How do those people move forward? Wholly. We know that our life ends on this earth, but we also believe that it continues. So I think it's important that I say this. And my passion is mixed with some anger, understandably, I would hope. So I'm not going to dwell on that too much longer. We do have a pending lawsuit, which that university is a party to, and another group of people is a party to. And I want to refocus and go back to indirectly. My work doesn't reach into forms of healing per se. Secretary Terry acquired the former Cancer Treatment Center in Tulsa. And for any that are unfamiliar with the Muscogee Reservation, we're one of the few with a metropolitan setting that sprawls and grows and continues to grow on our reservation. That acquisition was important to our people. It came at a critical time when COVID was at its peak, and it was a challenge for our leaders, including Secretary Terry. Not just our leaders. I'm not trying to isolate this. It was a true community and global matter. But once COVID moved out, we were at the facility. It's a real nice facility. I remember this discussion with Sean. We walked in, I get a tour, we get to the administrative offices, and I see some artwork that I recognize aren't from our people. The Muskogees and other tribes, many other tribes, have world-known, renowned artists in many medias. Secretary Terry made a commitment to not only dress that facility, but every other facility we're constructing with Muscogee art. That is where you'll find our creation story. That's where you will find our plans, the system of our plan, the matrilineal leadership that has allowed us to survive for years. And I've heard from more than our citizens how comforting when they walk through or are wheeled into, in some cases, the registration area. How soothing that makes them feel. And to Doc's point on more than 39 tribes, on the drive up, Secretary Terry and I talked about Tulsa, Council Oak, and the growth that we're experiencing, but we also talked about the citizenry. We mentioned that, you know, there could very well be over 500 tribal citizens represented in that Tulsa metro area. The feeling of coming into a tribally operated facility, that in itself can be comforting to any of those 500 citizens. By the way, you know, statistically, I think Secretary Terry mentioned last year we had over 200,000 visits that our health systems provide, not just in Tulsa, but throughout the reservation. One final point I would like to make, Tanner, as far as our work, mine and Chief Hill's, and its indirect relation to Secretary Terry's work, is the language, the use of our language. Our language is gifted to our people. It's very important to us. It's a living language. It cannot, we can go to any courtroom in this state and hear the English language spoken. And we have some skilled wordsmiths that can take a meaning of a word in the English language and transpose it into meaning something else, or implying it means something else. In our language, it being a living language, it is straight and to the point. It can still place reference to time, but it is absolute in its meaning. And that's why I think it's very important that Secretary Terry is seeking patient advocates who are as fluent as we can be today. Our nation suffered a large loss during COVID to cultural and traditional ways, including the language. But we're making those moves, and I think it's important that we talk about those in this setting and beyond. But
Absolutely. And I appreciate you sharing this word. And for those of you who are unfamiliar, some of the elements that you're describing, Mr. Fife, are the removal history of many of the tribes that are now here in the state of Oklahoma, including from the Southwest United States. They're here because we were forced to be here. And you can feel the grief. It's still alive and well to this day. So I appreciate you sharing those comments. And I'm going to stay with you. I'm cognizant of the time, and so I'm going to go through and ask you each just one individual question. And I'd like you to kind of build on what responsibilities or values that you carry or that you see Chief Hill carrying in making those determinations for your tribal citizens. You talked about how comforting it is, and it would be for me too to walk into your facility and see that. What are some other aspects of that, of responsibilities and values that you show up in your role and with that eye towards the community?
thank you for that question. My response is that when it's easy for me to work alongside Chief Hill. We both come from the ceremonial grounds. And through those practices, those exercises, a lot of skills are honed that matriculate into key leadership. And patience is one. The ability to see a problem through multiple perspectives is one. The analogy of the round table. Nobody's the head of that table. We're all equal. That all ties together. And those practices and principles that are, thousands of years old are what affects our approach to working with outside partners. We uniquely know that there are different goals of our partners, yet we have a commonality. And that commonality is rooted in mankind. Us being only a small piece of our local communities, our state, the United States, and the world, we understand that if we're to coexist to the highest degree possible, we have work to do as well. In terms of sovereignty, now there are some things where we'll absolutely stand up for and preserve and fight to protect, like sacred sites. There's no wiggle room. But science, and the importance of science that ties to that sacred site is my Miko. I'm 52 years old. Miko is the chief of our ceremonial guard. He's been the Miko for 54 years. My whole life, and that's a lifetime appointment. My whole life, he's been our leader. And we have records of what clan each one of us are, our warrior names, etc. And that university in the Southeast said, oh no, you have a competing claim because this John Swanton book said so. Even though our own records, our own history, our oral history, the preservation of those things clearly sets path for one to be the Miko of Hickory Ground. And you have to be matrilineal descendant, period. You have to be of this clan, period. So science, the university says, we're not going to approve your claim unless you submit to DNA testing. Now, that's where we have a big problem with science and a lack of understanding. I'm not going to say this institution's an enemy. They could very well be a friend at some point. We have shared interests. I stick to that. Throughout this continent, our ancestral lands and where we are today have shared interests. And we have to find ways to cultivate those relationships that I know that some won't be a win-win for everyone. But by talking about issues, that we move further down the road.
Thank you, thank you. Chris, this next question is for you. And this question centers around what better partnerships could look like from your perspective. Are there ways that research or healthcare efforts have either honored or misunderstood traditional healing in your view? If this even comes up at all.
Have they honored? Well, just kind of thinking, we got ceremonies come up on ceremonies that, people come and participate. They want to be a part of that. Just want to check this out. Coming out and taking part in ceremonies, it's a sacrifice. There's hardships that you put up with. You do without comforts. And for us, it's a good 2 weeks being out in the heat, and being with your people, suffering with them, and it's not all hardship. It's not all bad. People don't attend those ceremonies just because something's wrong. There's other aspects of good things, celebrations, achievements, milestones, and they come out there for different reasons, and sometimes because of environmental or health conditions, with chronic disease, they may have complications or issues, and requires them to go to visit a local health provider, usually in a small town, in a rural town. So sometimes the judgmental aspects of our tribal people, of why they do that, why they choose to do that, without really understanding or being in their shoes, So I think that the need for cultural competency training is, very important to help educate them, with regard to traditional healing, ceremonial healing. And it's not to discount, the many, many, many researchers that are out there, providers that do respect that traditional healing. I think that there are definitely more of them than there are the ones that perhaps are the bad apples, and bring that down. But it does kind of give black eye to the larger population. But I think that just by having situations like this, forums like this to help educate, this goes a long way. I've got a good friend up at Roswell Park that does great cancer research, Rodney Harry, that I've known for a very long time, and I admire and appreciate his engagements with making meaningful research, and change for his people.
Chris, have you seen success stories where someone has shown cultural competency in working with tribal members or citizens?
I think that this, working with Health Science Center, working with Dr. Dozier and myself serving on the Stephenson Cancer Center, the Tribal Advisory Group and the Community Advisory Group, it's an opportunity to interact and engage, and also seeing young researchers come in. Some of them are tribal, and you have an opportunity to help influence and educate their trajectory, and it's an opportunity ground level to, help shape what's going to be.
Thank you. All right, Vanessa, this next one's for you. What does building trust with Native communities look like? And why is it essential when working with communities or institutions like universities? You kind of touched on this a little bit, but this is an important one I'd like to get your thoughts on.
I think building trust, there's so many different levels to trust building. Some of this is around recognizing, again, that mutual respect, developing respect, trying to definitely see another's point of view. What are the motivations of an individual, of an organization, of various entities? And are there opportunities for those different motivations and interests to align? And where do they deviate? How can we be honest about these things? Developing an open dialogue. What does communication look like? Verbal and nonverbal. Respecting or having a sense of what is the work that's happening between the two individuals that are maybe at the table together, and then what happens behind the scenes as they go back to talk to who's in their circles. These are, the beginning levels of trust. Also, our agreements. These are ways that we put trust, our words, into play. What's the accountability in that relationship? How do we cease and desist? How do we call pause, time out, if you will? What does that look like? Thinking about timelines and being in discussion around, people, time, and money. This is often what I talk about with my research partners: people, time, and money. We talk about that internally and externally. What are these resources that are at play currently? And what's the value in the evaluation of different things? I'm an evaluator as well as a researcher, and I consistently go back to, how do we value different things? How are we showing that in our metrics, in our actions, in our behaviors? And to me, these are all indicators of different things. Many of those things are barometers of trust. And do we measure trust the same way? Do we see trust the same way? And dialoguing on that. So multiple levels of conversation. And at the end of the day, I think this is one of those things of, are we doing what we're saying? How do we show that? Is there a way of conversing about something in the same way that I could call my mom and talk about it around the dinner table, or talk to her over the phone in the same way that I would be speaking at a conference table or at a podium? These ought to be all the same in my mind. That's the internal trust, the trust of the community. But is the other person on the other end also bearing that in mind? Are they being the person that I know them to be? Is that agency being who they are? Have they already told me and I just wasn't listening? So checking in with others is another aspect of trust. It's not just an individual aspect. although there are individual characteristics. But when a community is allowing another group to come in, this is another layer upon layers of trust. And it's okay if it's shaky, because that's the building, that's the process. But do we want to try? And I think that's, to me, the biggest aspect is there enough interest in attempting to continue to work together, to hear each other out, to have the hard conversations, the places where it's difficult for those that are in the conversation. That is trust building to me.
Absolutely. And that's the root of any healthy relationship. Any healthy relationship. Dr. Dozier. This is on. Okay. Can you share a time when a tribal perspective reshaped how you approached your research or challenged assumptions you held, particularly around invasive topics such as medical history or healthcare or treatment?
Sure, I'd share maybe a couple things, and I also want to return a little bit to
Sure.
the
Yeah.
question too. One of the lessons learned in terms of tribal perspective is not all tribes have the same perspective, and that's okay. So I want to shift back to decades ago when I was doing my public health training, and we did not have treatment for HIV, and we had a lot of people at risk for HIV, and there were data about risk factors for HIV. And during public health training, some of the survey research we were looking at involved American Indian Alaska Native community data that would identify certain risk factors. And different tribal communities around the U.S. in terms of findings have different ways of wanting to interpret and use those findings. And that's okay. I mean, I think what researchers who are used to individual level IRB are not aware of is that there are tribal IRBs and tribal sovereignty and tribal rights. So in some circumstances, things don't necessarily go out into the public sphere in terms of peer-reviewed research, but they get shared within communities and what those risk factors are. And that's okay, because you do have to respect where the tribal position is on certain things, even if your own personal view might be that greater public knowledge might serve some good too. But tribal authority is essential when you're working directly with tribal nations. The counter story to that, of course, is there's been work with tribal nations in Oklahoma where I thought there might be concerns about sensitive topics, where the tribe has been at the leadership level saying, we need to do work to improve this vaccine or this test. So again, I think that the principle is you work with the tribes, you get to know where the tribes are at, and sometimes the tribes ask to do research in what other communities might think are sensitive questions. So there's always has to be that dialogue. And then the final point I wanted to make on this is, to me, it's very clear when you're doing research in partnership with a tribal nation or their healthcare delivery systems, Indian Health Service, tribal or urban, it gets to be more of a gray zone when there's work with individuals, but not directly with the tribal nation in the campus setting. This gets into biospecimen research, for example. And I think, you know, we've taken some steps to try to work on those issues. The Tribal Advisory Council that Chris is a member of. We've given grand rounds to various departments, oncology departments and other clinical departments about what working with tribal nations is and what that might mean for research that a person may be doing with their own patients or participants here at the campus setting. But I think we still have some work to do to try to figure out how to do this in a way that respects tribal authority, but isn't necessarily under the direct control of tribal authority. And a lot of that at this point is awareness and putting some structures in place.
So we are we're about 1:15, and I was hoping to get to questions from the audience, but I know we have food out here waiting for you all, and this has been a long hour. I can hear your stomachs grumbling, and maybe it's just mine. What I'd like to do is to invite the panelists. This is a curveball. Here's what's in the questions, but it's not that big of a curveball. I would like to invite you all for a final reflection. And I've heard messages of hope, because this can be very weighty, but I've heard messages of hope and opportunity from every single one of you. Are there any final reflections that you'd like to share?
You know, the individual and the role of traditional healing, the role that they play, you know, the activism that they play with assuming control of their health and being an active participant in. You know, that's kind of contrary to Western medicine, where, you know, it's all around them, but it's not necessarily on the patient. But, you know, with traditional healing and Western medicine, it definitely activates the patient to, you know, take an active role in their holistic health and well-being. You know, and there's just so many good things that come out of that. You know, the cultural preservation aspect of it, the immersion into their, you know, native languages and the songs and the ceremonies and the, you know, burning of the sweetgrass and stuff like that. My thought, you know, we are getting into the epigenetics and getting into the, you know, different levels with AI, but, you know, getting back down to it, I think that through that participation, it activates certain parts of the brain to help heal that historical trauma. You know, so as primitive as traditional healing may sound, you know, you're sitting on the ground and, you know, using plants and herbs and stuff like that, not precision medicine, I think that does far better as far as reaching the patient and what, you know, their holistic wellness. And Hannah.
I think the thing that I will share is something that happened to me just 2 days ago when I was preparing to come here. I was thinking, oh, gee, I really need to practice putting on my shoes that I'm going to be wearing up here. And I was sitting there, my youngest just came back from college, they're undergrad. And there I was, like, pulled out my shoes and I was trying to do my wraps on my legs for them. And my youngest just was looking at me kind of quizzically, and I go, Mom, you know, why do you have to be so independent on this? Like, you know, I'm right here, I can help. And I was like, but you won't be with me in the hotel room when I'm getting ready. You know, I gotta do this by myself. And they're like, you don't have to do everything by yourself. You know, you have, like, we'll let me help you with that, and then you'll practice also how you'll be in the hotel. But right now, like, as you're working on your new shoes, I just got these Mocs a couple summers ago, and I finally am wearing them. But they go, you know, this getting dressed is something that, like, you usually have somebody to help you with. This is not a solo thing, you know. And they go, why you don't have to be so independent, you know, that's something that you do, that's how you are, I get it, but boy, I just see you struggling and there's no need for it. And it's just that terrible moment when, you know, your children, if you're blessed to have people in your life, younger people in your life that look at you and just go, oh, you're the one who taught me this, and now I have to teach it back to you, that moment, you know. And that's the thing that they gave me so many thoughts in that moment of, you're right, I am foolishly struggling right now. This is something that I know how to do, but I'm not doing it well. And maybe I don't know how to do it like I thought. And I can ask for help, and I should ask for help. And how many times is it that I'm in community, but I'm not, you know? And it was just this reflection, I almost started crying because I was like, doggone it, child, they're a person that just knows how to say something in just the right way. I'm blessed with 2 kids, and there are times where they just say something that just gets me. It's right where it's supposed to. And so that's the thing I was thinking about today as I was getting ready in my little hotel room and also coming over and having to retie my shoes just outside of the building here because I didn't do it right. But it was that, we're in community and we can do things by ourselves, but maybe they won't be as easy, they won't be as well, there'll be a struggle. But what does it mean to be in community? And how do we let ourselves have that humility, which is something I constantly struggle with, is that letting myself rest in one another, and having that. And my youngest is often the one that gives me that hope, that recognition that there is so much more. They let me see how beautiful things are and can be, and that I don't have to try so hard. So those are the things I guess that was on my heart today to share, was that in this work, in this life that we're doing, it doesn't always have to be work.
Mark, any final questions or Mr. Barkley?
In response to your question, every tribal nation or the healthcare delivery system I work with wants to improve the health of their community, and that presents all these opportunities to do work in it, and cutting edge research in terms of where the advancements are going are all possible if those relationships are respected.
Reflecting through this morning or now this afternoon work, I would circle back and reemphasize the expressions that we've shared throughout this event, that we all seek better results, better healthcare, better partnerships. And though some of my comments may have been sharp about some topics, we are still seeking and appreciative of the University of Oklahoma, Oklahoma State University, Southwestern Oklahoma State. We have tribal citizens that are in all of these higher ed institutions that we expect to come back and contribute to us. So now the willingness of leadership, as outlined in the very opening remarks, policy has changed. The real work's ahead of us, keeping this thing on track, and it won't be easy, but not much has been easy for Indian country for centuries. So, but we're still here, and now we're at a point in time where we're accepted and increasingly respected, and we're going to be here. We are the long-term partner that can change worldviews.
So if today sparked a new idea or challenged your assumptions, we hope you'll carry that with you and continue the conversation. I see a hand. Okay, we have one question.
ago, we done technical about economics and policy, and the senior professors, which inevitably involve law, and the senior professors like Mark suggested me to reach out to you, Tana, for law perspective. And I remember you were so kind to share the suggestions, and you also mentioned that you haven't worked with IHS or on the health topics yet. So I just recognize that economics policy law for healthcare study among tribal populations, this is something that is really needed. So I was wondering what would be the panel's suggestion and Novo's suggestion about creating a multidisciplinary program where we're at least the research direction for the tribal population health.
So if I'm hearing what you're describing is a potential center of some sort that could bring together health, law, and policy. I mean, I support anything if it's going to help tribal nations and tribal audiences. And we're probably not going to be able to dive into that in this conversation right here. But like I said, I love that. And I think, and I do remember your email, and I think this is kind of in line with where I'm an Indian law attorney by profession. I never practiced in healthcare. I don't know all the things, right? And sometimes you're a jack of all trades and master of none. But I do know people who are helpful in that way. And, there's lots of opportunities for growth and consideration. It's exciting to think about those things. And we appreciate your work too. And thank you for being here. So we're going to go ahead, round of applause for our panelists here. Thank you so much. And thank you to all the partners who contributed and supported today's event. We have OU Health, we have Stephenson Cancer Center, we have the Native American Cancer Center for Health Excellence with support from the Improving Cancer Outcomes for Native American Communities grant. I know many of you are in the audience. Special thanks to Evelyn Cox in the back of the room. We also have Kwanayazi over here, who's been handling all of our tech for the event. Joy Penley, and also Grace Fox, our newest ad. She's our tribal healthcare policy analyst. She started yesterday. She helped check you in. Don't forget parking validation. The food is here. Please go eat it and take it. And this concludes our event. Thank you.
No hot light.